Good afternoon. My name is Rosalina Garcia. The topic of today's lesson is about ADHD. My attending audience will be parents who don't know the meaning of ADHD. Also, to be able to identify it on time with a professional psychologist or regular doctor. The name of the lesson I will be teaching to parents is how to identify a child who may be having the symptoms of ADHD and how to find professional help and treating according to the results. It's not easy to say how many teachers at school have told parents that their child has every behavior of attention deficiency hyperactivity disorder. Yes, they are educated as teachers or instructors and educating children of all the subjects being taught. If their profession is teaching and don't have a PhD, how can they diagnose a child that instance with ADHD? Every child goes through a phase in growing up with a behavior issue that is part of growing up. My objectives today for parents is to define attention deficiency hyperactivity disorder, how to identify ADHD, and explain the types of treatments or medication for controlling ADHD. After these lessons, the students were able to define ADHD and identify what it is. Also, the treatments and medications that are recommended by a professional physician. These objectives will give the students an idea of learning the difference of the symptoms and behavior of ADHD and why it's important to catch it on time so a parent won't struggle later in life with the child. What is ADHD? Attention deficit hyperactivity disorder is a neurological condition that involves problem with inattention and hyperactivity, impulsivity that are developing inconsistent with the age of the child. It's a function of development failure in the brain circuiting that monitors inhibition and self-control. Risk factors of ADHD. It's inherited genes, environment factors during infancy or pregnancy, brain injury, alcohol or tobacco use during pregnancy, low birth weight or premature delivery, and gender. There was one study found that ADHD runs in the family, or several genes that make people more likely to develop ADHD. The exposure to toxins such as lead may increase a child's risk for ADHD. A small number of children who suffer traumatic brain injury may develop ADHD. A study with the Washington University School of Medicine found that pregnant women who smoke increase their child's risk for developing ADHD. Drinking alcohol and using drugs during pregnancy can also increase a child's risk for the disorder. Also, if a woman is pregnant who doesn't smoke, use drugs, or drink, may likely to have it if the father of the baby does. It goes both ways. According to a study in the Journal of Pediatrics, babies born before their due date are more likely to have ADHD than when they're older. The main symptoms of attention deficient hyperactivity disorder. The first one is inattention. The second one is hyperactivity. And the third one is impulsivity. These are the main symptoms of ADHD. Inattention is more not paying attention in class and what the teacher has to say, are always playing with something or making noise. Hyperactivity is when the child is getting out of his chair and bugging other students in class, always talking and jumping around. These students are more likely not to focus in doing any assignments assigned to them. Impulsivity is more in doing things without thinking of he or she can get in trouble. They just do it with no remorse. What does inattention look like? A child has difficulty keeping their mind on a task or gets bored of a task easily. A child who jumps from one task to another without completing its first task. A child who forgets and loses things that they need to complete a task. Here's a picture of a child who dozes off in class as the teacher is lecturing. She gets really distracted in something else. When time comes to the assignment, she will have a hard time doing the work because she didn't pay attention to what the teacher had to say. What does hyperactivity look like? A child who can't seem to sit and who is constantly moving and roaming, touching things, screaming and fidgeting. Here's a picture of a boy He got a lot of things in his hands, started disrupting other classmates with making planes. He has a phone, making noise with a car, a pencil, and with the paper. What does impulsivity look like? A child who speaks or acts without thinking about the consequences of the act. A child who blurts out inappropriate comments, has difficulty waiting their turn, and displays their emotions without restraint. Here's a child who's picking up a chair, and the other ones are sitting quietly while this one's having fun with the chair in the air. ADHD, getting a diagnosis. A child who is inattentive, hyperactive, or impulsive does not necessarily have ADHD. Many normal children have some of these symptoms, especially young children. The symptoms could be caused by another disorder entirely. It's very important that children are examined and diagnosed by a qualified professional who will use strict diagnostic guidelines to determine whether the behaviors are inappropriate for the child's age and whether the symptoms indicate ADHD or not. Talking with your family physician might be a good start. There's always some warning signs of a child with ADHD. The teacher usually sends them home to give parents explain what he should observe unexplained behaviors in the child. Also, there could be other individuals who say your child is weird and needs to be checked out. Children have different behaviors while growing up. Each child can behave at their age and others can't. He or she stay behind the stage of development. For a child to be diagnosed, the first step is getting consultation with a doctor to evaluate and then make a referral to the therapist or psychiatrist to get tested with questionnaires, Talton test, broad spectrum scales, tests on specific abilities, computer tests, and brain scans. When all the tests and procedures are done, then the results will come in if your child does not have ADHD. The next step will be learning how to manage the symptoms by treatments or medications. Here are several accompanying disorders with ADHD. The first one is bipolar disorder. Children with ADHD can also have bipolar. The difference between ADHD and bipolar disorder in childhood can be difficult, however, as some symptoms are present in both disorders. The Tourette syndrome is a small proportion of children with ADHD also have neurological disorder, which can be controlled with medication. Learning disabilities. About 20 to 30% of children with ADHD also have a specific learning disability. Oppositional defiant disorder. As many as 1/3 to 1/2 of children with ADHD also have ODD. Conduct disorder. About 20 to 40% of children with ADHD will develop conduct disorder, which is more serious pattern of antisocial behavior. Anxiety and depression. If concurrent occurring anxiety or depression is recognized and treated. Here are different treatments for ADHD. The first one is stimulants, like methylphenidate or Ritalin. The second one is non-stimulants, atomoxetine and guanfacine. The third one is antidepressants, tricyclics. The fourth one is therapy. The fifth one is education and training. The sixth one is school-based programs. Although it might be unusual to treat ADHD with medication that is considered a stimulant, it is effective. They do not make children feel high, and there's no evidence that stimulants, when used with the treatment, cause drug abuse or dependence. There has been research on why stimulants are very effective because the medications increase the brain chemical dopamine, which plays a central role in thinking and attention. Non-stimulants medications take longer to work than stimulants, but also can improve focus, attention, and impulsivity in a person with ADHD. Recently, at least one non-stimulant has shown great potential for reducing the symptoms of ADHD. Non-stimulants are prescribed only if he or she has a bothersome side effects from the stimulant, combination with the stimulant to increase effectiveness. Antidepressants have not yet been approved by the U.S. Food and Drug Administration, specifically for the treatment of ADHD. Antidepressants are sometimes used to treat adults with ADHD. Tricyclics are older antidepressants are sometimes used because, like stimulants, affect the brain chemicals norepinephrine, and dopamine. Conclusion. ADHD is not just a childhood disorder. The symptoms of ADHD begin in childhood. ADHD can continue through adolescence and adulthood. Warning signs for people with ADHD show an outgoing pattern of 3 different types of symptoms: inattention, hyperactivity, impulsivity. Although there's no cure for ADHD, currently available treatments may help reduce symptoms and improve functioning. Children and parents might need special help to develop techniques for managing the pattern of behavior. No single biological cause for ADHD has been found. Most research points to genes inherited from parents as the leading contributor to ADHD. ADHD often runs in families. And here are my references.